facial aging process, basically a lot of it is genetics, okay? And all we have is, I guess you could say, you chose the wrong parents on some of them, okay? And of course the next thing is smoking, okay? You know, we all know that smoking is detrimental. When I was doing implants at the time, the success rate was in the 90s, high 90s for implants. If they smoked, it dropped way down by like 20%, okay? I think it's probably still a similar stat. I know practitioners that if you're smoking, they won't even place an implant, okay? But chronological aging, yes. And premature aging from sun exposure, yes. We were the generation that sat in the sun in the 70s and 80s, and now we're going to suffer some of the consequences of that. And how do we go back and how do we treat our generation? Chronological aging, okay? Now this is soft tissue. Now I'm going to be putting some things down here, and I want you to sort of be thinking in 3-dimension, okay? Because it's easy to put these things on paper, but when you start thinking in 3-dimensional aspects, you'll understand how the face changes at different ages. So soft tissue loss, basically, we lose collagen, okay? And then we lose elastin, and we lose hyaluronic acid, okay? These are natural components of our skin, okay? So that with these 3 being lost, okay, if you took a patient and just removed the tissue or the fluid that's there, what would happen is it would start to show more bone and would start to show more fat pads, just if you made it disappear. So what it does is it gives our face and body a 3-dimensional and a volume type of appearance. So that alone can change the shape. Now the most interesting thing is that these are components, but the temporary or reversible dermal fillers, do you know what they're made of? They're made of hyaluronic acid. Okay, so later on we're going to get into how you're replacing a dermal filler, and I will be talking about quickly over dermal fillers later on in the afternoon, but we're going to be replacing something that was natural in the body. Okay, the only thing with these is that the body replaces these every day to 5 days, and as we age, for some reason from about 20 on, it doesn't keep up with it. And as we get older and older, these soft tissues go away. Now the next thing that what happens is that we have subcutaneous fat pads, okay, in our face, in our brow, in our nose, in our lips. These decrease in volume, okay? Okay. Now I want you to understand that we're talking about volume, how it decreases in volume. Then what I'm going to be saying is that these fat pads, because of changes in the face, slip into a different area. And that decrease in volume, combined with a slipping into a different area, creates the effects that we're going to see of an aged person, okay? So what we have here is this is the ptosis of the fat pads, and ptosis is just a fancy name for drooping, okay? So what we have is we have these fat pads here, infraorbital, and these 3 in this area. And you'll see that these are lined up along which fold? Nasolabial fold. So what happens now is that in a young person, they're non-existent. So as we get older, you have these pads, and you see that as they slip inferiorly, they create this fold. But they also decrease in volume. So what you see is people's faces going concave and drooping. So in this 3-dimensional aspect, we've got to understand what's happening here. And I'll come back to this from a Botox standpoint and also from a filler standpoint. Okay? So this is the type of patient that you would say, and you've got patients like that in your practice, right? Okay, at least I do. You know, they don't all look exactly the same, but that age group, I would say late 50s, maybe 60, okay? And basically she's got lost nasolabial folds, and what is this? Women do not like this. That jowl in our office, and we'll show you our technique of what we do. I have a patient mark on their own picture the thing, before I even see them, what they don't like about their pictures. So they're sharing with me from their heart what they don't like. They're not listening to me say, oh, I can make you feel better. They're sharing with me. Okay, so that's our approach. But this here now, I want to throw another thing into. This goes down in this area, but the primary muscle of facial expression, what is the primary muscle of facial expression in that area? We never think about it. Platysma inserts right there. Platysma is the largest muscle in terms of area in the head and neck. It inserts all the way across, all down in the clavicle, all the way down, and it comes all the way up and attaches in the corner of the mouth. So what we're going to do is we're going to go through all these muscles in detail. Then we're going to go through and say, how do the muscles now relate to the aging process at different ages in terms of 3-dimension and in terms of what's happening. Now, the chronological aging process, that's soft tissue, and we could have a great discussion on that and for hours, really. Now, the hard tissue remodeling of craniofacial structures, we're a little bit more familiar with. If you're doing implants, well, you have to know what's happening in the maxilla and mandible, okay? But not just there. But in orthodontics, we know what's happening with the changes over from cephalometric analysis, what's happening. But now, through all the analysis, they can look at this really carefully and look into this. So that what we've got, in general, what happens is the orbital rim decreases. And this is what I'm talking about, an orbital rim. This area right in here tends to go down and backward. Okay? So what we have is a soft tissue on the surface, a phenomenon that's occurring with age. And then at the same time, the hard structures that are the basic support of everything are also changing. So the next thing we have is we have the maxillary process is actually flattening. So it's not only going inferiorly, but what happens from this aspect, it's going posteriorly. So we are losing volume from the underlying support. So then what we have is the temples. You'll see the temples go from convex to concave. And your older person, you'll see instead of having the fluid, the mass here, it starts to go in. We also see the chin and nose are more prominent. As you get older, we see there's effects because the frontal area is flattening. This is going inferior and posterior, and the nose actually grows, but it also is made to look longer, and so does the chin. On men in particular, you'll see 60-year-old man with a huge chin that he didn't have when he was 20. Now, if you understand and looking at from the sagittal point of view is that if these things are growing out this way, what we now have and everything else is going back, it exaggerates the aging process. It makes it look much more dramatic than it actually is. Now, the thing is that we observe is basically we have the dental vertical. Okay? Now, in this, okay, not very many studies talk about this at all. Not every person has lost vertical, but I'm sure you've got a number of patients that have worn half the occlusal surfaces off, okay? And you look at that and they're eating their upper lip. The upper lip is right down there, okay? So all these things happening at the same time cause us to basically look at ourselves and say, what do we see in the mirror? This is the aging process. So we got the results of tissue loss are this, is that we have, with all these soft tissue and bones, we have nasolabial folds, okay, appearing. We now have oral commissures or marionette lines, and what I'm talking about is from the angle of the mouth here on an angle going sort of laterally. Well, you'll hear me refer to it as a marionette line, okay? And then what we have is sagging and hanging of skin. Some of it is because of the lack of elastin, loss of elastin, collagen, and hyaluronic acid, and other aspects of it are because of the overuse of some muscles. Now imagine in the platysma muscle, the shortest distance between 2 points is a straight line, okay? It attaches way out here, but it attaches down here. So every time you activate that muscle, it wants to pull out in 3-dimension like this, okay? Men look good. They're a good football player with a big neck. Do you think women want to have a big neck? No. But over the course of 20, 30 years, they get this excess neck swelling. It's a stretch of the skin. So we have a stretch of the skin, and it's not necessarily fat pad related. Like, it doesn't have fat adipose tissue in here. It's stretched. Are you familiar with necklace lines? Necklace lines here. So when we're treating someone in the face, in the upper areas, women are cruel to each other, and what they'll say is that, oh, they've had Botox or they've had a smile makeover. Look at them, and they'll say, why? Well, look, she's got necklace lines, or look at her neck. It shows how old she is. So part of the combination treatment has to be addressing the issues that those people feel. Not only do we make them feel good up here, you want to make them feel good down here. Otherwise, they've got a turtleneck on or something that's high. Okay, so we'll go into that. And so what we've got are the concavity of the cheeks. Okay, now the concavity of the cheeks is something that, I forget the exact percentage of edentulous people in the United States, but it's high, and I won't quote it because I don't know it. I know the Canadian one. So anyway, what happens is that concavity of cheeks happens because of bone and tissue loss, but what did we, or our predecessors, what did we iatrogenically impose upon them? We extracted their teeth, so they've lost alveolar process, they've lost tooth structure. And if you looked in 3-dimension now, most muscles act in straight lines or things, but if you looked at my mouth, there's a point out here and there's a point back here. And my mouth, the orbicularis oris, sits and it's suspended. It has no bony insertion, and it's held by muscles going up and down. But the thing that keeps its form is the teeth. So if you go and address the form of lips before you've addressed the teeth, you don't have the proper form. If you don't address the loss of tissue up here before you go and address the lips or teeth, then you're going to have excess tissue when you're finished. Now I'll jump a few things ahead now. Now for those of you that are doing smile design, you don't do a smile design with $1,000. It's 10, 20, 30, 40, could be $50,000. What we have been not observant, or we didn't have the armamentarium before, or we didn't realize, that do you not think if someone spends $30,000 to $50,000, they're not going to spend $500 more to get rid of the wrinkles and have some enhancement on their cheeks? And that's what we see happening. I was at one giving a presentation, and as I was in it and I was presenting this, one of the fellows who was a fantastic smile design man in Vancouver, he sat there and he said, "Oh, that's why," out loud. And I said, "Can you share with us?" He says, "I did this beautiful smile design, had just the right amount of tooth on all these veneers showing. She came back in 9 months," and I said, "Oh, look, too long." That was it. She had had the cheeks and the lips enhanced, and it curled everything up and exposed too much tooth. So what I'm trying to do is say there's a sequence of doing it, and what we've got to think of all these underlying things happening. What this is probably maybe a 40-year-old, a 50-year-old, and a 60-year-old, plus or minus. In the 3 dimensions, what we're looking at is that from this going in here, you'll start to see the loss of volume. Okay? You also start to see the appearance of sagging because of volume. You start to see the appearance of the pull of the platysma. You go to this point of view and you really start to see it pulling. You drop down to this one and you sort of see from here, you're looking at the side and you look at all the support here. You start to see that inferior bone disappearing, posterior bone disappearing. You start to see this hollow. You start to see these hollows, these hollows, these hollows, and of course, what do you see starting to develop here? You see a beautiful, well-defined arch. What women like. Just beautiful, nice arch, nice narrow neck. Come 50, 40-ish in here, you start to see this jowl appearing here. You start to see another jowl appearing here. And I'll show you later on, it captures it in the photographic series, is that these are the pull of platysma. Can we address them with Botox? It's a piece of cake. Can we solve it right off the bat? Okay, well, it's part of the process. It can tighten things up. Do we need other armamentarium like lasers? Yeah, they'll help. Okay. Can we catch it early enough? And there's Botox, can it be done preventively? And I'll show you some studies on that. Okay. So that what I'm trying to answer is, it's safe? Yes. Is it can be done preventively? Yes. If people come in and they say things to be done, women, if a woman came in with this picture and was looking at it, she will go right off the bat. She doesn't go to the lips usually. I don't find that. What happens is they go to these lines right in here, they circle down in here, and they go in here, in that order. Lips comes fourth or fifth when given the presentation. Okay? So, if I can do, this is done by Coleman, I'll put a star beside it. Okay, this, I think if you can take this picture and look at it when you go home, you'll love it. You'll understand the basics of what I'm talking about for this first while. Botox first. Does it have to absolutely be first? No, you can start in any manner you want. Okay, you can start with lasers first. You can start with this. What do I do first? So my preference is Botox first. Okay, and I step into it and I see what results, what effect I get, and then I move on. Okay, and I will say again, we take the photographs every time that patient walks in the door. So Natasha would take the person and they open the door and the patient now walks to the photography room, because we've done it in such a way that they want to see what they look like. It's not a chore. Okay, so what we've got is Botox is subtly changed on the smile design. You can have the width of the smile. So if we actually can unfold the corner of the lips, we're going to see a little bit of change in what you see as width of teeth. You're going to see the shape of the smile. You're going to be showing more teeth, more of the tooth, and the length of the tooth this is the key thing. Okay, so if we look at something like this, we have this patient, and okay, we went back in, we did some Botox on this patient, and all we did was treated forehead, glabella, and crow's feet, and that was it. So what happened is that this whole area smoothed out, and I haven't got this in function, I'm just showing you, but there's a difference. The same person took that same picture in the same room on the same seat with the same camera. And what we see is there's a change in shape all the time of what happens with that patient. It's subtle. You have to go in there and say, now what is exactly happening? But every 2 weeks when we bring that patient in, it's consistent, okay? So what we have is a patient comes in like that, and there's a change. You ask them to say the same word. Can you just smile for me? Smile. Can you smile for me? Smile. But there's a change in shape. What we see when we look a little bit closer, just we want it relaxed. We want you to do a relaxed thing. So we're looking at the form of the lip. We're looking at, we haven't done anything down in here. We haven't done any filler in here. And basically what we do is we see, okay, this is the patient, same seat coming in. And what we start to see, not on every patient because it's different ages, but if you look at the amount of tooth that's showing here, and you look at the tooth that's starting to show over here, you now start to see more tooth. And this is like a 45-year-old patient, and that if you see it on a 30-year-old patient, you see it go up. And all we're treating is the upper face. So there's something that goes up and out, and the overall pull of the facial expression changes. And you'll hear me refer to grouping of muscles, or how muscles group together and they coordinate together. So levator labii superioris alecinesi. This is the one that I was just telling you I treat with caution. Gummy Smile. Okay, we've all got them there. When I was in dental school, and it's still done throughout the world, they treated it really easily. You sent them to the oral surgeon, and they did a Lefort 1. They raised everything up, and there you went. And you know the problems after that, or you know, it's a big operation. What we're looking at is this muscle right here. It's called LSAN, L-L-S-A-N. Okay. So this muscle comes down here, and it's actually a group of 4 or 5 muscles, and it goes all the way up into this area and extends up in here. So that's why I say if you lay the pencil down here, stay away from it at first, because you don't want to, when you're doing and you're just trying to get nasalis, go too low. By too low, I mean onto the cheek, off the nose, because you'll get a different effect. You get a droop. And if you relax it up here, you're going to have this come down. So what we want to do is understand that certain portions along that muscle, if we inject, we can cause it to relax, and it to relax the orbicularis oris. Okay, so we're going to go in, and in this case, well, maybe I moved these up here. So we have this, and we have this person smile like this. So in this case, we would be pretty woman, and as soon as she smiles, you don't see her forehead wrinkle, you go right to the gummy smile. Unfortunately, beautiful, beautiful woman. So what we would do is we would inject here and in here into the bottom of LSAN. And what we're doing with that is that we're relaxing that portion of the muscle that's holding up that lip. We're talking like 1 unit. Don't even go to 2 units, really, particularly on a younger person. An older person like me, you're going to have to adjust dose. A man, you're adjusting dose. But on a woman like that, 1 unit. So what we do in something like this, which is the gentleman I showed you earlier on, everything's finished nicely, but if we went back in there and did 1 unit here, I could drop that. But probably on that man, I'd probably have to use 2. Older man.
Warren,
Yes?
where along that muscle do you inject? Bottom, the top, or the middle?
Bottom. I'll show you on this patient here. This is a before, and this is just we have a patient smile. Okay? And basically what we've done here is the muscle comes down here and it goes all the way into orbicularis oris, going around like this. It goes all the way in. It's at this triangle here, right in there, is where you inject. Okay? Now, you can play with it as you use different approaches, because different gummy smiles, some are just in the center, and some, you know, like if it was just a center gummy smile, you can move over a tiny bit to confine it. But generally, you can put 1 here, and that'll droop it. So that was 2 units. In our office, we charge $12 a unit. So what happens there is for $24, I've treated her, and she's as happy as can be.